Another common question that comes up is age limits for bariatric surgery. How young is too young and how old is too old? And our program, we do patients who are at least 18 years of age and older. The patients who are younger than this are getting bariatric surgery these days, but usually this is done at specialized centers who have dedicated pediatric bariatric programs for children. And bariatric surgery for children is a complex field. I think it really is. I think it's a good thing. There are some patients who desperately need this, but at the same time we want to make sure that all of the pieces are in place for the psychosocial support that they're going to need, them and their families, because this is a very complicated thing about why this patient has developed this level of severe obesity at this age. Those things need to be addressed at the same time. And it often involves some very complicated, very sophisticated management of just family dynamics. And I think all those things need to be available at the center where children are undergoing bariatric surgery. Also, bariatric surgery in children is a new field, and I think it should be done in centers that are studying this carefully, accumulating information so that it can flow out into the general public. Children who need bariatric surgery and are very interested in it should look to centers that have these specific pediatric bariatric programs and proceed very carefully into this. The upper age limit is unknown. It, to me, is really a function of the patient's cardiovascular fitness and the risk-benefit profile of the operation. If the operative risk is reasonable and the chance of improvement in not just the weight but the patient's quality of life is good, then I think patients are candidates irregardless of their age. But as morbidly obese patients get older, they age rapidly, and their heart disease is at more advanced stages, and their lung disease. And so we have to be really careful about these other illnesses that affect the risk-benefit profile. So as far as what's the upper age limit, I don't know. It really has to do with the patient's individual cardiovascular fitness. And those are the things that we evaluate when a patient is seen in consultation.